Thanks, David. Our next guest graduated from UC Berkeley at the age of 16, and he became the youngest ever neuroscience PhD student at MIT. Well, now he's doing some of the most important research in the world right here in our own backyard. He is the CEO of San Francisco-based Clara Health and the co-founder of World Without COVID. Evan Ehrenberg, thank you so much for joining us.
Thank you so much for having me on the show.
Well, Evan, let's dive right in. Tell me about World Without COVID. What is it? What are you doing?
Sure thing. So, just to history, we started Clara Health 4 years ago to democratize access to clinical research to help the public be able to more easily volunteer and take part to access whether it's vaccines or treatments or diagnostics. And we've done this for every condition that's out there. And with the COVID-19 pandemic, we wanted to take all of the research that we had going on with the platform and make the public aware that we're a free resource that they can use to contribute to ending this pandemic and accelerating medical research. And so we actually had Raj Kapoor, the Chief Strategy Officer at Lyft, reach out to our team to ask about creating a registry and a platform for helping expedite this research. And we had already been working on that, had that underway. So we sort of joined forces and created World Without COVID, which is this nonprofit initiative that we're powering to allow anybody, whether you do not have COVID-19, whether you currently have it, whether you've recovered, to actually take part in this research and help us end this pandemic.
What will this research find out? Will we find a cure? Will we find a vaccine? What are you finding out?
So there are nearly 1,000 clinical trials being run on COVID-19 right now. And there's everything from what you might think is the obvious, like obviously there's research on vaccines and treatments and diagnostic tests, but there's also research into the effects of this pandemic on our population, on our mental health, on how effective different social distancing measures have been. And so there's just such a broad range. This is so important to society, and the research has started so recently. We're just trying to find out as much as possible, and we're happy to play our part to help try to expedite that.
Walk me through how people can help be a part of this incredible research. So I go online, I look up World Without COVID or Clara Health, I register, I show up, I donate blood plasma, I donate blood. Walk me through this process.
Sure thing. So you just go to worldwithoutcovid.org. There's plenty of information there to walk you through everything. But to join, all you need to do is fill out a really short form. It just kind of goes through, your some medical conditions around COVID-19. And we just use that information to be able to match you, of the 1,000 clinical trials out there. We just want to show you the ones that are actually relevant to you. And so once you fill that out, it takes 1 to 2 minutes. We show you all of the opportunities, whether it's in research, whether it's in blood plasma donation that you have available. And then you can click through to read more about those, ask our team questions. We're happy to help out. And then anything that you're interested in getting involved in, you can just apply right there, and we'll only share your information with the research studies that you apply to so that they can validate that you're an eligible participant. Otherwise, we only use your information to show you what's relevant.
You mentioned blood plasma. Why is that such a need for people to donate blood plasma to research right now?
Sure thing. So we talked about how people are studying vaccines and treatments and diagnostics. And one of the treatments that is being investigated is the use of blood plasma donated from people who have already recovered from COVID-19. The idea being that you have antibodies for fighting COVID-19, and doing a transfusion of that blood plasma in somebody who, for example, does not yet have COVID-19 but may be an at-risk population. It may make it less likely for them to get COVID-19, and doing it in patients who currently have it may make their symptoms less, or it may help them recover faster. These are still being investigated, so there's clinical trials that are testing them to see how effective it is, but they can't run if there aren't people donating blood plasma to be used as the potential treatment.
And just to clarify, are you looking for people to come in and help with this kind of research who have already tested positive for COVID-19, or does it matter?
It actually doesn't matter. With with about 1,000 studies on the platform today and many more being added every single day, there's an opportunity for everybody to play a part. If you're healthy, then you're needed for vaccine trials, you're needed for diagnostic tests. If you have been infected, then you're needed for treatments. And if you've recovered, then you're needed for different diagnostics to test for antibodies and for things like plasma donation. And in general, even outside of these sort of interventions where you typically would have to go in person somewhere, there's a lot of virtual studies that are being run where it can be as simple as
Ooh.
downloading an app on your phone. There's things that are recording your cough to try to help with diagnostics. There's mobile nurses who will come and do blood draws. So a lot of this can be done from your home very, very easily with just a few minutes of your time.
Evan, there are so many unknowns with what we're dealing with and living through in this time. Um, how, just from your standpoint, and I know that you don't have a crystal ball, but where do you think we are in finding some real answers here? Knowing whether antibody tests show whether we can get sick again or not, knowing whether there's, just all these crazy questions that we all have. How close are we to finding real answers?
So we're finding more and more every single day, but I would say that we're still in the early phases. So a lot of the treatments that are being tested right now are actually treatments that had previously been tested for other conditions that are seeing if they work here as well. And there's new research that's being done on COVID-19 specific treatments that are purpose built for this, but those are going to take even longer. And so what we're likely going to see is it's not going to be that all of a sudden this is fixed, but we're going to have research come out, and our methods of handling this are going to gradually get better. And this applies to everything from treatments to the tests being better to the ways that we employ social distancing strategies, figuring out what's really working best and iterating on that. And that's what we're going to see come through the following months. Is we're just going to continue to gradually get better at this.
Evan, being that Clara Health does all this kind of clinical research day in and day out, did you see this coming?
The spread of the pandemic was not something that we could have fully predicted. We were in this as much as anybody else in healthcare was, and hoping for the best, but sort of preparing for the worst. The one thing that I think we are not surprised by is the speed of research. I mean, research is incredibly slow. Make sure that's done, in an effective manner, in a safe and ethical manner. And a lot of that has been expedited because of how important this pandemic is and how important the research is to a solution for it. But what you see in clinical trials is 86% of them fall behind schedule because they don't
Mm.
have enough eligible volunteers to take part. And you see the same thing in COVID-19, which is why we built World Without COVID to sort of help people do their part to volunteer and take part for this research and make sure that it doesn't get delayed like most other clinical trials do.
Okay, come on, Bay Area. You have a job to do. If we're going to wipe this thing out, if we're going to all get through this together, you need to step up and become a part of these clinical trials. I'm in. I'm in. My veins are in. Whatever you need from me, I'm in. I'm in. I'm in. Evan, one last question before we let you go. What is getting you personally through this great pause?
I feel so fortunate to be able to work on something that is impactful. Our entire team feels really, really fortunate. One member of our team actually lost her aunt to coronavirus infection this year, and has really felt empowered to be making a difference on it. And so every day, getting to wake up and work on this and help people and help the research is really meaningful to me. But on top of that, working to eat as healthy as possible, make sure I'm keeping up with exercise and doing things like meditation and stretching. I mean, these are all things that have been proven time and again to be really, really helpful with mental health, which is going to be something that's absolutely critical in this time of shelter in place. So I've been trying to keep up with those as much as I possibly can in between the work.
Evan, we are so incredibly lucky to have you here in our community and to have had you here on our show. Thank you so much, Evan Ehrenberg, World Without COVID and Clara Health. Please, everyone, go to worldwithoutcovid.org, sign up to be a part of this incredible research. Evan, any last words?
Just thank you so much for having me. Thank you for anybody watching who does decide to join the World Without COVID initiative. We're so thankful for your help. The world is. And if people are interested in clinical research in general and how they can help with other conditions, you can just visit clarahealth.com. It's entirely free. We're happy to help out and answer any questions you might have.
Thank you so much again. All right, David, I think we have a tall order here. I know I'm ready. I'm ready to donate blood, donate plasma. What are you going to do to help out here?